Good morning, everyone. Yeah. So I'm Madam Sim. I think semua tahu saya lah kan. Alright. So today we will start for this training course, postnatal care training programs. Alright. So before we start, let's do some ice breaking. You know me, but I don't know you. Right. So tell me a little bit about yourself. Okay. Come, tell me about yourself. Right. And also, how long you have been working in confinement center? Not necessarily in Kai but maybe start from after you out from school, and how long you have been in this field. Okay, and also, what is your expectation that you want to learn today in these 2 hours? All right. So something very simple. Just let me know about you. Okay. Can we start from that side? Yeah. No need to stand up. You just share a little bit about you. What's your name? Yeah. Siapa nama?
Saya Maureen.
Okay, Maureen. Ada anak?
Saya ada 2 anak.
Okay.
Amiri juga.
Alright.
Lepas tu,
This one.
how long have you working in confinement center? Almost 2 years lah.
Okay, very good. Okay. And this one?
Purpose learning.
What you expect to learn today?
Pengalaman lah.
Okay, can accepted. Right, come next, mommy. Thank you, Maureen. What's your name?
Nama saya Yansa.
Okay.
Saya bekerja di confinement selain kait almost 3 years lah.
Almost 3 years. Okay.
Hari ini ada tambah pengalaman lah.
Okay, tambah pengalaman. Okay, very good. Thank you very much.
For a year.
Okay.
I have no background in it lah.
Alright, never mind. Good.
The purpose of learning to know discover more about psychological reproduction.
Okay, Ken, thank you very much.
I have 4 children, single mother, working in confinement center 1.5 years before this environment, now 1.5 years.
Alright, so about 3 years, Okay, good.
Purpose of learning, reflect back, and gain more knowledge.
Okay, gain more knowledge. Thank you very much.
Hello, I'm Nomi. I'm almost 1 year here. Almost lah.
Alright.
Purpose to gain knowledge.
Okay, good. Thank you very much.
I'm Heidi, and I've been working in the conservatory for 1 year.
Hmm.
And the purpose of learning today is to gain more knowledge so I can answer more questions later.
Good. Yeah, hope can really help you. Right, very good. Thank you.
Saya ada 6 orang anak.
Oh, very expert already, Okay.
Sudah mati juga lah.
Okay.
Saya dalam confinement baru hampir setahun juga lah.
Okay.
Lain-lain baru 4 bulan.
Alright. Alright, good.
Nak cari pengalamannya
Okay.
tidak. Tapi nak kalau tidak boleh banyak lagi pak. Nak cari untuk ilmu.
Okay, very good. Yeah, so the person. Okay, our next mommy. Okay. Okay, very good. Alright, thank you very much.
Kalau you have been working confinement, saya dalam Bukan. Sudah kerja aku.
So about 4 years, okay, very good.
So fokus learning tu ada yang baru dapat bantu mami-mami sini lah.
Okay, very good. Thank you very much.
Saya pasti bakal mak kedua anak.
Okay, very good.
Sebelum ni di blessing 1 tahun ada. Untuk learning nambah ilmu.
Okay, very good. Okay. Okay. All right, very good. Mm-hmm. Okay, this is a new one. Before that, ada kerja tempat lain, confinement center, nursing home. So it's totally different one, huh? Okay, very good. Okay, gain knowledge, right?
Hello, saya Salisa. Saya kerja dekat sini almost 1 year.
Alright.
Saya apa Kak Nomi? Tambah ilmu.
Okay, tambah ilmu. Okay, very good. Thank you, everyone. So I think that is why we have this course today. Tambah ilmu. I think confinement center serve a purpose to make sure everyone know how to work well in confinement center, because you are actually nursing not only baby but also mother, right? Yeah. So today we will learn this. Okay. So about me myself, yeah, Madam Sim. Saya ada 3 anak. Okay. And then in nursing life, I think more than 20 years already. Right? In between these 20 years, I work in a hospital, work in a university, and work in confinement center. And now we open a own lactation center, Love Lab. Right? So that's why I'm here today as a nurse, as a midwife, as a lecturer, as a lactation consultant to guide you this course. Alright, so our objective for today, so that you'll be able to identify common postnatal issue, support maternal recovery, offer nutritional guidance, conduct postnatal assessment, and also provide proficient breastfeeding support. And our learning outcome after the training, then you will gain comprehensive postnatal care knowledge and skill to provide effective postnatal care and supports to new mothers and to be prepared to work at confinement care center. So this one, hopefully it will upgrade your level in your skill working in confinement center. Alright, so we'll go to module 1. You have all the workbook, right? Okay, so module 1, first lesson that we want to learn today is normal physiological changes in the postnatal periods. We all know mother got a lot of problems, right? Okay, so during postnatal, selalunya you have encountered mothers, right? Regardless of you are housekeeping or you are admin, marketing, or you are nurse in nursery, right? We all know that when mother comes in, after beranak, they usually encounter some problems. So what is the problems? Usually that you've seen before. This group come. Problem? Breast engorge, okay. Wound pain, okay. Selalunya emosi, selalu mau marah orang. Okay, what else? Depressed. Nangis. Okay, what else? Any other? Worry of how to take care of baby. Yes, especially first time mom. Any other answers? Don't know how to breastfeed. That's why Madam Sin selalu sini. Yeah, what else? You encounter anything? Complain about the food. Ini tidak panas. Tak cukup panas. Saya mau panas-panas punya. Enggak nak. Yeah, maybe lah. Yeah, bad temper, yeah, emosi, alright. Yes, they actually got a lot of discomfort. Now today I'll bring you in here, then we understand mothers better, right? Then we will know how to nurse or how to communicate with them better. Most of you here are mothers, yeah, most of you. That day I think we have mostly are single. Today one we have mostly are mothers before. Yeah, you have give birth before, so I think you understand mother before. But sudah lupa mungkin lah. Right? So today I recall back for you. Right? So the postnatal period, we also call it puerperium. Right? It start after baby beranak. Dia sudah dilahir lah. Right? And last 6 to 8 weeks. Means that during confinement, we call it postnatal care, right? They stay here for how long? Berapa lama? 28 or 40 days, right? Yeah. You will see 42 days is about 6 weeks. That is usually in theory, we call it confinement. And this postnatal period, there is a lot of changes. Changes into what? Transform into transformer kah? Tidak. Masa beranak, masa pregnant, sini lemak, sana lemak, right? And all the system upside down. And it takes 6 weeks go back to normal. Bukan 2 minggu, bukan 1 minggu. Even the perut besar, it also take times back to normal, right? Yeah. So it takes how long? Yes, it takes about 6 to 8 weeks, or we make it 6 weeks, yeah? So during this time, mother's body actually undergoes various physiological changes as it recovers from pregnancy and childbirth and return to the pre-pregnancy state. Ini perlu ambil masa, bukan hari ini saya beranak, besok saya slim down already. Ever got mommy worried by 1 week later on, dia tanya, kenapa perut saya masih besar? You see that mother so slim already. Ada kah? Start risau. And then, lepas tu dia cakap to the auntie, kasih saya setengah nasi cukup, saya tak mau makan banyak. Because I'm still fat. They worried. So, what is the advice to mother? 1 minggu dapat kah back to normal so fast? Cannot. It takes how long? 6 to 8 weeks. Right. So, how are you going to tell mothers? Sabar dulu, mami sabar. Like that kah? Oh, we cannot use sabar. Oh, sabar. Lagi sabar, lagi dia geram. The words that we have to use is, don't worry, mother. What you want to explain to her? Tell her the real fact. Can get 1 week back to normal? No, it takes how long? 6 to 8 weeks. Even when mother is crying, later we'll talk about emotional. It takes how long for mothers to get back to normal, right? So, about 6 weeks, okay? And, right, sorry. And firstly, lepas mother beranak, usually they will feel cramping. Cramping dekat mana? Kaki ya? Where? Perut. The perut after baby out, and mother can still feel like, kenapa masih sakit? Especially when they breastfeed, right? Once breastfeed, memang sakit. Kenapa? Because breastfeed and it can cause contraction because release of hormone oxytocin. Yeah. Then this oxytocin will enhance the contraction. Kasi kejut cepat sikit the rahim back to normal. Do you know how big is your rahim before beranak? At the moment, now inside you, how big is your rahim? Berapa besar? Can you point to me? Just pakai your tangan, this big, this big, this big. Come, show me your hand. How big is your uterus? It's okay because you never learned before and it's okay. You just teka. How big is your uterus? This one, okay. Who else want to teka? This one, okay. How big is your uterus? The rahim, bukan ovary. Berapa besar your uterus? Uterus, what is the shape? It's like a triangle shape, right? So ini uterus berapa besar? Yeah, no matter what you point, it's within your hand. I don't see anyone point like that, right? Yes, that is correct. It's about 7.5 cm. Very tiny uterus. But masa pregnant, berapa besar the uterus can goes up to? Wah, betul-betul boleh simpan satu big baby. Not only one, can simpan dua baby lagi, kan? So you can imagine this big uterus after baby is out from the uterus, and this rahim jadi macam mana? Lembek, kan? It's like a balloon. After keluar the baby, then it become kecut. So kecut, within one day, kecut back to this size? Will it back to this size immediately? Lepas beranak? Tidak. It takes how long? 6 weeks. Yes. So during this 6 weeks, you will see this uterus begitu besar. And it needs to be contract slowly back to normal size. So how it will contract back? It needs hormone oxytocin. Jadi itu oxytocin dari mana? While you are breastfeeding, and mother can feel it strongly contract. So breastfeeding helps for the healing. Right? That's why we always encourage mother breastfeeding. It's not only for baby, but for mother herself. It can help to kecut balik the rahim lebih cepat. Some within 2 weeks, mother don't feel the pain already. Yeah, because of breastfeeding, then it heal faster. Okay, so mother will feel cramping. And masih ingat that cramping? Those who pernah beranak ataupun lupa already. Lupa sudah. Some don't even really feel it. Yeah. Some you just feel a bit discomfort. Tapi for you, you can tahan. But have you ever seen mother complain perut sakit sampai sangat sakit and need painkiller? Not the cesarean pain, it's the uterus contraction pain. Pernah? Pernah kan? Some mother will complain pain. So it's very discomfort. And we call it bleeding. But actually that is not bleeding. What is that? We call it lochia, right? We call it lochia. Or that is because the uterus contract. Yeah, I will show you the words. When the uterus contract, jadi inside there's some blood, some residual yang tidak perlu akan keluar dari badan, ya, dari rahim. So we call it something like periods, right? Postnatal kan dia ada berdarah lagi, dia perlu pakai pad, right? Right? So we call that lochia. And mother can feel the tummy is very tender. So mother sometimes hairan because first time mom. Kenapa perut saya masih keras-keras? Is that keras good or bad? Should feel lembek or should feel keras? Lembek. It should feel tenderness. So when mother lie down, once come in, if you palpate the tummy and the tummy feel very hard, sangat keras di sini. That is good. It means the uterus is still contracting. Kalau dia lembek, you touch, sangat lembek, and the bleeding is heavily flow. Then you know the uterus is not contract and dia pandai berdarah banyak. So when mother asks you kenapa contract, your reassurance is, ini bagus. Ada contract itu bagus. Jadi you punya rahim boleh kecut to the smaller size. So when you touch tummy after deliver, especially the first 2 weeks, when you feel the tummy is hard, is that normal? Baru saya cakap. Tender, normal. So you perlu ingat because these are the questions that mother may ask you, right? So you have attended this class. And Madam Sim said, yes, lepas beranak perut rasa tender. That is normal. Kalau sangat sakit, for some mother it's very painful, for some mother it's not. And the tenderness, dia bukan selalu. It is also come with a few minutes then go off. A few minutes and go off. Or it is worse when mother is breastfeeding. Because it can cause more contraction. Right? Jadi, ada tenderness after beranak, normal or not normal? Normal. You have to be confident that it's normal. Kalau lembek, berdarah banyak, is that normal? Not normal. Our action is immediately sent to hospital. Right? Jangan tunggu sana lagi. Tunggu sekejap, kita cek lagi. Yeah. So, it is good if the perut is tender. Now, this is what we call the discharge. Right? Lokia. Lokia is a medical term, or we call it the periods after beranak. Masih ada berdarah kan? Ya, berapa pad you tukar? Ada you monitor the pad? Ya, perlu monitor kan? Tapi tak tahu kenapa nak monitor. Just monitor sajalah. Tulis saja. Nanti doktor sendiri tengok. Right? Today I'll tell you why we want to monitor the blood loss. Right? Every day we ask mother to change pad. Kan? Kita nak check. And usually the blood loss is getting more or getting less. Yes, it's getting less, right? So this blood loss, we call it lokia. It is a vaginal discharge after childbirth and consisting of blood, mucus, and some uterine tissue. Until bila habis for this blood loss, sampai the uterus back to normal size. So usually when you do the pad chart, sampai bila mother tell you only stand sahaja, nothing already. Usually bukan masa dia mau balik kan? Usually after 2 weeks, dia sudah kasih tahu kamu, this one already no more. I just use this one mini pad only, panty liner sahaja. Usually about 2 weeks. But for those mother who is not breastfeeding, it may last 3 weeks or 4 weeks. They're still using the normal pad, right? So mother who is breastfeeding, then the blood loss and the uterus will contract back normal, and the blood loss will reduce. So mother actually more healthy. Right? Kalau satu mami selalu berdarah banyak, that's why you have to feed mother with the red dead drinks to replace back the ions for the blood. So if you can help mothers to breastfeed more, mother less blood loss, they heal faster. Right? Ini boleh faham? Okay. Now this lokia, of course, we divide into 3 stages. First stages, we call it lokia rubra. Now, this is just for your knowledge. Lokia rubra is a bright red, heavy flow, and it lasting for 3 to 4 days. Means that the first few days, blood loss, it is actually very fresh red color. Yeah, just like our first day periods. Dia sangat banyak dan very fresh color. When it comes to about second week, 4 to 10 days, we call it lokia serosa. It is more to pinkish brownish. The color looks more dark color, right? And it lasts 4 to 10 days. Akhirnya, lokia alba. This one is more on yellowish white discharge. Means it's habis sudah, almost finishing, right? Then it lasts about 6 weeks. So this one, it really depends on mother. If mother breastfeed more, it will not last for 6 weeks. It will only last maybe just 2 weeks. So when you check pad, mother will say, oh, saya tak ada tukar sudah. It's just a panty liner, right? It's just a little bit normal discharge, right? So that is normal. So this is what we call normal lokia. But if mother comes in, therefore, supposed to be pinkish brownish, tapi mother tell you, saya 2 jam tukar sekali. And it's a lot. So what happened to this mother? Something is not right, right? Yeah, we shouldn't have seen mother bleed a lot when they come to confinement center. And the amount should be every day getting less. Tapi bukan hari ini tak ada, besok banyak. No, it is abnormal already. So when you do pad chart for mothers, yesterday, a day before, semua normal, half quarter pad change, half quarter pad change. Then today when you come on shift, mother tell you, I full pad sok. Mungkin saya makan kacama lah. Sometimes they will tell you lah, I makan kacama, that's why I full pad sok. So our action is monitor. 2 hours or 1 hour later, you have to check mothers again. If mother say, I tukar lagi pun still full pad sok No, you don't wait. You can tell your manager or can ask mother, ask husband, bring mother, immediately go hospital for a check. That one is not normal, Because usually the blood loss will getting less and it will not getting more. If it's getting more, it means maybe there are some uterine tissue, some tissue inside the uterus belum dibersihkan. Jadi uterus tidak pandai contract, then dia pandai bleed a lot. So these one need treatments that need to go to hospital. Alright. So for blood loss, you have to remember it is getting less, bukan getting more. And it also will not like suddenly today already day 7 sudah kurang, tapi tiba-tiba day 8 dia banyak. Nothing to do with the makanan. If it's makanan, usually it's just that moment. Let's say pernah tengok kah when mother after taking kacama or some herbal soup, after that suddenly bleed a lot, but just for that moment, after that tak ada sudah. Got? I think that is quite normal lah. That is how the herbal lah, kacama did, because it will help to contract your uterus. It will trigger the oxytocin hormone and to pass out the, we call it dirty blood. Yeah. So it will just maybe once, it will not lasting like continuously every 2 hours. Yeah. So this one remember, if anything that you are not sure something is not right, immediately report. Okay. So we have to tell mother, take good care of the lower part also. Say, what is my advice to change the pad? Berapa jam? 4 hours. That is the ideal one. We need mother to change pad every 4 hours to maintain the hygiene. Okay. And usually, lepas beranak, when they come here, especially I think our local people here, they don't dare to touch water. Am I right? And how they cuci the pepet? How they cuci then? Tak ada cuci kan? They will just put on the pad, right? Yes, or they will use wet tissue. But when they will use wet tissue and the hand is still very dirty and your toilet will be blocked and the maintenance will be habis cerita and they will keep complaining already when you call someone to repair for the toilet, right? So we still have to advise mother. I know there is a lot of pangtang lah, regardless of Malay, Iban, Chinese, semua sama. I think in this place in Sarawak I think almost about the same. Tak boleh sentuh air, yeah. But in confinement center here, how you want to advise to mother that they actually pangtang don't want to touch water? Anyone encounter mother like that before? So what is your solution? Pernah? Mommy said, saya tak mau sentuh air. My mom asked me don't touch water. But you come in and say, Mommy, you need to clean after every time pass urine, pass motion, you need to cuci. Mesti perlu cuci because confinement center here, they provide the herbal wash for you already in every toilet. So you need to wash. Tak mau, saya tak boleh sentuh air. So what is your advice? Using glove? Okay, they will use glove. Okay. So that they don't touch the water. But that one's the joke, man. It got warm one. Very good. So they will still wash and you tell them the solution. Use the bidet lah, Okay. Any other methods? Or you have seen mother did that before? God. Only use bidet. And mostly mother now okay already, is it? They can touch water, right? Okay. Have to touch water. Have to wash. Because if you don't clean properly, I tell you that is the worst, I think, unforgettable memory as a nurse in labor room for me. Kalau beranak, I'm happy to see all the beranak keluar, the baby keluar, even sometimes mami tahi pun keluar, berak pun keluar. For me, it's still okay, right? Acceptable. But if a mother tak mau cuci for 1 week, lepas dia after labor, what will happen to her? Infected. Kalau pepet infected and it's got bleeding there, got lochia still, and mother don't want to wash, just dab with the tissue sometimes, and it is infected and got pus. So at the end, sangat sakit, sudah demam, come into the hospital. Once doktor buka, tengok, okay, habis cerita, masuk labor room, we need suture, or we need to do dressing. We need to pack gauze inside. When we heard for the wound repair, aduh, semua punya misi itu mask tak tahu pakai berapa layer, because it's very, very smell. And the doctor comes out, honestly, when the doctor comes out, the doctor say I need to bath a few times. I think the smell is still like a perfume stick on my body, you know, and it's very smelly. Okay, smell is one thing for us, but for mother, it is suffering. And it takes weeks to heal for the wound, because if it's really breakdown wound, doctor only can pack gauze, clean, do I&D, clean it, pack dressing, and you need to come every day to change the dressing. Sampai dia sudah heal, then only you have to suture balik. So it takes 2 weeks at least to heal. Jadi you have to tell mothers, hygiene is more important. Tak boleh sentuh air, pakai glove kah, pakai bidet kah pun boleh. Every time lepas kencing, lepas berak, mesti nak cuci. Yeah, if they complain of pain, have to seek for medical advice, right? Because I don't expect you all know how to inspect the wound, right? If we don't know, we can ask mother to see doctor. Yeah, so it's okay that you don't know how to view. Yeah, tapi we can be rational to hear mother's complaint. Yesterday ada sakit kah? Tak ada. Today ada sakit? Ada. So the pain is worse than yesterday. Means that something is not right. If the pain is getting worse, the score from 0 then suddenly go to 5, the pain score, means something is not right. Kenapa pandai sakit? The pepek can be infected already. It can be swollen up, or it can be bleeding, right? Internal bleeding, bengkak sudah. So all this will cause pain, cause uncomfortable. So have to see doctors, right? Okay. So after talk to about uterus, pepek, now we see the breast changes. I think breast is more common, and I think most of you have encountered this. Selalu mami cakap breast sakit kan? And I heard the mother's feedback from you all. You all help a lot on the breastfeeding parts. When mother comes to you, because they only see me once, so you are the one who always assist mother, which is very good, right? So for these breast changes, is actually undergo significant changes to prepare and to sustain the breastfeeding. So because of the hormonal changes, it will stimulate the milk production and ejection. Then breast may become larger, firmer, and also be more tender. Saya ini tak perlu saya cakap pun kamu orang tahu kan. Once coming, the next day surely complain of susu bengkak. So when susu bengkak, this is something common, right? But can it be prevented? Can it be prevented so that mother tidak complain susu sakit? Huh? How to prevent? I think there are some mother totally tak ada breast pain punya. What did they do? Latching. That is the paling basic things and paling natural way for mother to do. Baby keluar, lepas lahir, definitely breastfeed. Kalau dia breastfeed on demand, definitely mother will not feel breast pain. But how many of them do that? And I think mostly we also never encounter mother did that, right? We just tell mother, oh kalau bengkak, okay, you pakai inilah, pakai itulah, macam mana massage lah, this and that. Yeah, so here, what you all can help mother is to encourage them breastfeed. Confinement center is not only here. Most of the confinement center, because you are a service line, and most of you want to take care of the baby and make sure mother rests. Am I right? So most of the time, sorry, I think that's my feedback. Mother, when mother asks for baby, nurse also will say, Mami, you rehat lah. Tak apa, baby kami jaga. Mami, breastfeed sudah 1 jam oh. Kasih kami lah, baby kasih kami, you rehat. You are very gentle and very kind to mother. But in the other way, when we take away the baby, then you will see the baby is not breastfeeding on demand. And the next thing mother will cause breast tenderness, right? This is very common because nurse takut kalau baby selalu dekat bilik mami, nanti bos tanya, Ingat kita ini ya, mau curi tulang pula, right? So, but we think in the other way. If the mother wants to breastfeed, we help. If the mother don't want, then of course we take it. So we have to help for those mother who want to breastfeed. Is that okay? Because I think admin also here dengar sudah, so they will understand better why you put the baby in mother's room, right? So you explain to mother. As long as we know what mother wants, then you actually can provide a better care. Okay, all right. When we talk about breastfeeding, that is another big topic. So today we just want to make sure we can manage on the breast tenderness, especially because of the milk kick in, usually day 3 to day 5, right? So frequent breastfeeding or on demand is the first thing we have to encourage mother to. Kalau untuk mami yang tak mau breastfeed, pump or hand express. Yeah, all these hand express or pump, it has to be regular. Satu hari berapa kali? Yes, every 2 to 3 hours. Tell mother there is no way like lazy. Bolehkah saya pump 3 kali saja? Cannot. Kalau dia mau buat 3 kali sehari, means that she will still encounter engorgement. Yeah. For how long? Maybe for 1 week, 2 weeks, then baru dia rasa lega. So why mother want to suffer for the first 2 weeks? Yeah. So you have to be firm and inform mother. Kalau tak mau breastfeed, then you have to regular hand express. Adakah termasuk malam? Yes, including night time. That's what they have to do. Or you can tell them, let's say the breast is really engorged, then we do warm compress. Okay, that with hot compress. Hot compress for how long? 5 to 10 minutes. Good. Only 5 to 10 minutes. Or 3 to 5 minutes pun sangat-sangat cukup already. It's not the whole day pakai hot water. It's not whole day. I think Kaya are still very good. Like all the nurse won't advise mother to hot compress the whole day. Some, yeah. When I asked, they said the nurse asked me hot water, just compress for whole day. What will happen to the mother? What happened to the breast? Semakin bengkak, semakin bengkak, semakin bengkak. Instead of you want it to reduce, right? Because you keep giving hot water, you activate. So the susu semakin banyak. Then it get worse. So hot compress only to do before feeding. Sebelum dia mau feed baby, baru hot compress. Or sebelum dia mau pump, baru hot compress. Other time, let's say, dia sudah pump 1 jam. 2 o'clock, baru dia pump. By 3 o'clock, because belum sampai masa, right? By 3 o'clock, dia rasa sangat sakit. So, what should we encourage mother to do? Cold compress. Yes, use cold compress to reduce the discomfort. Or this mother just finished pumping, or just finished feeding, but still engorged. But she want to stop because it's already long, more than 30 minutes. Then that is the time cold compress also. But if cold compress mother said pang tang tak mau sentuh air sejuk, can we replace with? What can we replace with? Can. So replace with what? We don't want to use the ice cube or ice pad. Some mother okay, so they have ice pad themselves. They have the breast pad, right? They put in the fridge. But some mother, they don't want to use sejuk. Right, there's a contrast for the confinement periods. So we can use one type of vegetable. Apa itu? Kubis. Yeah, so center actually can prepare kubis. You just put in nursery pun boleh. You just, if mother got this engorgement, you just tiak kasih 2 piece timbang sini. Yeah. You make salad to eat. Right, so that is after breastfeed or after pumping, you want to make sure mother feel comfort is cold compress after breastfeeding. Alright? And make sure avoid excessive cleaning, especially nipple and areola. We've seen a lot of mother, especially after COVID, mami selalu wipe, cuci nipple before they want to feed baby, right? Or after baby latching pun dia cuci. Satu hari saya rasa 10 kali, 20 kali dia cuci nipple dia. Ya, before pump cuci, lepas pump cuci. What happen next? Kalau dia selalu cuci. Crack. Bleeding. There's one mother come and ask me, just text me one problems. Easily crack, want to consult me. Ayo, I should ask her to come. So that's why I boleh untung tu ya. But on the phone, I have settled her problems. Because she always do excessive cleaning. And the problem settled. Means that my advice to her is, jangan cuci. You mandi saja cuci. You no need to cuci every time. Kenapa? Yeah, our breast, we have nipple and we have areola, right? Right. Now, areola side, that areola ada, this areola, this side, ada sebum, ada ointment. Pandai berminyak-minyak sikit kan? So every time we change bra also we know. Selalu mak cuci is the middle one, right? Because got stain. Then what is minyak? What is the minyak for? It's the protection. It protect your nipple. Other than protection, apa lagi? We call it mother smell. Bau mami. That's the natural things that when baby come to mommy, dia sendiri cari kan? Because baby can smell susu. Yeah, so kalau mommy keep wipe away, then you will see the baby tak dapat cari lah. Then we have to guide the baby. So don't wipe. The sebum, it can help to protect nipple. Secondly, it can provide mother's smell. Thirdly, it also antibacterial. Yeah, so don't wipe away. It actually helps a lot. So we tell mother just gently clean enough. Mandi clean. Unless mother baru habis makan this chicken ginger with a lot of wine, then sweat a lot, and then sangat masin lah. They want to wipe okay, but not always. Kalau selalu cuci, sebelum baby come cuci, lepas baby feed also cuci, then you will see the problem comes in with cracked nipple. So now you pun pandai sudah avoid all this cleaning, this cracked nipple. You can help mother on the cracked nipple, right? So kalau betul-betul crack, what should you do? Or what is your advice to mother? You think, oh, sudah merah loh. How? What to apply? Susu. Susu apa? Yes, susu sendiri. That's the best. Better than the nipple cream. Yeah. You always see I bring a basket in, right? Inside my basket, ada nipple cream one. Right? I will use a different size lah, right? Some lecithins. I bring all this, but no nipple cream because the best nipple cream is your breast milk. And how to prevent it crack. Of course, there is other way of crack is because baby tidak betul feeding. Jadi, baby only hisap dekat nenen puting saja. Jadi, dia crack. So, we have to teach mother the proper way how breastfeed and also how to take good care of the nipple. Then, there is no cracked nipple, no nipple sore. Yeah. So, now you have another skills. When mother tell you, Missy, tolong tengok. Okay. Crack already. Then, you have to find out why crack. So, the common problem is because feeding tak betul or mother keep cleaning. Then you can give your advice already. Boleh ingat? Yeah, you can write it down if you want. Okay. Because all these are the tiny things that mother may encounter. It's not a big issue like heavy bleeding. No. Sometimes mother really tells you, I got cracked nipple lah, I got headache lah, this and that. Very, very tiny things. So, when we want to do it, it's not like, saya pun tak faham nanti you kasih Kylie kasih tahu Kylie ayu kasih tahu Naomi ayu kasih tahu mereka lah, saya tidak pandai. Like that. Then what is the image? Even you are just caretaker as a nursery staff, but if your answer is, saya pun tak faham then next thing mother might thinking of this kind, adakah mereka send the nurse pergi training right? So what is the proper way of answering mother? Even you lupa baru saya belajar yesterday from Madam C. Tapi saya betul-betul lupa. Because you are only in this confinement maybe just 3 months. Tadi siapa 3 months only Yeah, you never encounter mother, so you are a bit scared, not confident. So what is the proper way to answer mother? What do you think? The best way for you to answer? Let's say mother asks you, I got cracked nipple, but you've forgotten what you have learned today. What is the best answer for mother? And you also think, what is the best answer? Kalau mother tanya you sesuatu that you tak faham, you pun tak tahu. Firstly, we don't give the answer, right? Firstly, you ask question. That's the technique of how we handle mothers. Even you tak tahu, you jangan show, saya tak tahu, oh mami sorry saya baru di sini 3 bulan. Then they might think, Kylie, I want to call you. Come, personal talk. I don't want this nurse to nurse my baby because she only worked 3 months here. Adakah? Some fussy mother, they really reject if you have no experience. Jadi, no need to tell people how long you work here. You ask questions. They ask you, crack nipple. Then you ask further questions. Berapa lama sudah crack? You know the WW, 5 wife and 1 husband, remember? Macam mana ni boleh berlaku? Mami you sejak bila? Berapa sakit? Yeah. Baby macam mana feeding? You ask a lot of questions. Lepas tanya question, mami already inform you this and that, inform you this and that. Say, I think this thing, I have to ask manager to come and have a look. I think this is also not normal. You can tell her your opinions, but you don't give answer. Saya rasa ini memang because of baby latching salah. You don't give answer because you're not sure, right? So you ask questions. After you ask questions, you get more information. Then you say, okay, macam ini, mami, I think this one need manager to come and have a look. Is it okay? I call Yvette, I call Kylie, come have a look. If you are the mother, satisfied or not? Satisfied or not? You puas hati kah? Because this nurse really concerned on my questions, really concerned on my condition. Yeah. Kalau you tengok mother kasih tahu kamu because of cracked nipple, terus you cakap, ayo saya tak tahu, nanti saya tanya nanti you terus jauhkan diri then mother might think you not even concerned on her feeling, her problems, right? Tapi if someone tell you a problems and you keep asking, ayo, mana sakit sini sakit kah? Ataupun sini sakit, mana sakit? You show your concern and mother will feel better. Rather than, sakit you ada makan ubat lah. Then you walk away. How would the mother feel? Yeah, so when someone tell you the questions, what you need to do? Ask questions. It show your concern. Walaupun you takut lah. Or maybe this is a very VVIP, the head of the hospital one, pengarah apa. Sometimes, because Kyle very 5-star, sometimes you might meet someone is a singer kah, very famous person kah. You takut, jangan takut. Keep on asking question. Yeah, you don't need to takut. Oh, okay nanti saya suruh the senior come. Then they know you are not senior. Betul tak? Then they might think, this is junior. I better don't want this person to assist my baby. I don't want. They reject you. Siapa punya masalah? Is it the management go and tell mother because this is junior? Tidak. You sendiri yang pecah rahsia. Right? So you show your concern. Okay. Next. So far okay? Boleh ikut? Any questions so far? Before we go? Alright. Okay, so breastfeeding, okay. Next one. Now, when we come to this hormone adjustment, this is the one always cause mommy go crazy one. Because of all the hormones during pregnancy, semua naik. Estrogen naik, progesterone naik, whatever hormone naik, right? So becomes like mother upside down, right? Then after beranak, lepas beranak, semua ini hormon suddenly turun. Right? All the estrogen, progesterone, semua drop dramatically after delivered. Then it will really affect the mood and also physical recovery. Selalu, it takes about 2 weeks. Yeah, you will see mother sangat emotion. Ada? Do you know how mother feel? Yeah, imagine on the time before you have your periods. Pernah ada orang cakap kan premenstrual syndrome. Jadi what is your PMS? What is your problems before period datang? How you feel? Rasa mau marah orang kan. Setiap hari tengok Kylie happy tapi hari ini saya tengok dia, saya rasa saya mau marah dia saja. God, every day you are okay with chicken rice, but today you see chicken rice, you rasa memang no appetite. But you crave for chocolate lah, ice cream lah. Yeah. Pernah? Oh, you just sitting there. Ayo, husband come back pun rasa, penat tengok muka dia. Kenapa saya suka dia? Ever? Yeah. So sometimes these are the emotion that mother feel. Apa dia pandai itu? Okay, kena. So if you have very strong PMS syndrome, then you know better why mother very emotion after beranak. Because your premenstrual syndrome take for how long? Berapa hari selalunya? 1 week Ada begitu lama? Yes, about 2-3 days These 2-3 days you pun rasa sedikit kisiau sudah. Right? Kenapa saya suka sikit-sikit sudah menangis. Sikit-sikit rasa mau marah orang. Ada? Yeah, but we know how to control ourselves. We know that almost, because you will feel a little bit discomfort already. You know soon your period is coming. Yeah. Maybe some youngster, you don't have these PMS problems. I mean, that is good. You don't ask for it. Right? But some of us, some women will feel it. But for mother, this kind of emotion, it takes how long? Tiap-tiap hari tak selesa. Rasa mau marah orang, rasa mau sedih saja, mau nangis saja. Makan ini tak betul, makan itu tak betul. Kayak already serve so premium food, pun dia rasa tak ada rasa. It's not because of your food. It takes how long for mother to experience it? So for normal woman before period, it takes us about 2-3 days, right? But for postnatal mother, it takes about 2 weeks. That's why I always inform staff, the first 2 weeks, whatever mommy complain, you try to fulfill what she wants, but don't take it too much. Pernah, mommy tengok you pun dia terus terang. I think you tak tahu macam mana jaga my baby. You better don't touch my baby. Then you might feel, ayo, sedihnya. Maybe I'm not good in this career. I better change job. Yeah, sometimes we feel very negative, right? But please don't take it, because this mother don't mean it seriously, right? For the first 2 weeks, they might just hentam everything. Hentam on their own husband or hentam you. They will hentam their mother-in-law or hentam you. Usually they can't express too much or marah. Even they tengok the mother comes, mother say, don't touch water, don't touch this one. Mother-in-law also come. Hey, you better don't eat this one, don't eat that one. So for mother, can they scold their own relative, their own parents? Usually they are not. I say, okay lah. Tapi inside her heart is so sedih already. And when the husband come also, you better listen to your mother. Your mother asks you don't eat this one, that one. So she might feel that nobody understand me. Hello, I'm staying in confinement center now. Someone is giving me food. Someone is taking care good of me. But sekarang my problem is sakit sini. Do you ever understand or not? Me sakit sini. You keep asking me, don't eat this one, don't eat that one. And then why baby jaundice? And asking me, yalah, I tell you don't eat papaya during pregnant. And now baby jaundice. Mami kena marah. Betul tak? Kena blame. What have you done during your pregnancy? Already asked you, don't eat this one, don't eat that one. Now baby jaundice. Mami yang kena marah. Pernah tengok mami like that? Or you yourself, have you ever encountered this? When you're pregnant, when you're postnatal? Yes, sedih. You rasa, itu papaya is not an issue. I'm a nurse, I understand. But your family member don't understand. So you feel very sad, right? So this kind of emotion, when they jumpa you, and you are the one tidak wrap baby properly, only tidak wrap baby properly, or you kena marah sudah. Right? So sometimes it's not that mother gila or they're really very bad temper. There are also a woman who is very gentle woman, gentle lady, they want to treat you all very nice, but somehow because of the emotion, yeah, unfortunately, sometimes they marah the one that they pet lah. It's not only nurse, I think Kylie or Naomi, maybe, we don't know, right? Yeah. So that is how we call hormone changes, especially the first, how many weeks? The first 2 weeks. Yeah. Okay. And you will see the prolactin hormone increase because of to produce milk. Oxytocin also increase. The rest of the hormone reduce. So this oxytocin will cause mother having sakit perut, uterus contraction, and can cause milk ejection. But it is a good bond with baby, because oxytocin, we call it love hormone, right? So how are we going to help mother so that cut short or reduce the stress? How? Do you know why in confinement center usually they serve dessert? Selalu tengok mereka makan kek, sedap kan? Tengok ayu, air pun meleleh sudah. Not nice or not? See, as a normal woman, usually we are happy with dessert. So the dessert actually can reduce stress. Pandai mereka buat kerja, buat business. Serve mommy nice dessert so that mother reduce the stress. I think mother also ever share with you, all right? Saya tengok that treadmill makan pun bosan sudah, but every time waiting for the dessert. Pernah? Yes, because it make them happy. Even some mother said, I can eat cake ka? I can eat this cake ka? I can eat that cake ka? So you have to pandai-pandai and tell mothers lah, right? Okay. Balanced diet is a must. No matter what race, Malay, Chinese, Iban, whatever race, we will have to be balanced diet. If they say they don't want to eat kacama, then we replace other things. Not necessarily kacama, right? And if they said they don't want to eat veggie, then you have to explain to mother why we need veggie. Kenapa mami perlu balanced diet? Ataupun makan daging saja the first 2 weeks. Pernah mami request like that? No veggie, only meat. Yeah, but I'm sure you all still serve veggie, just that mother tak mau makan lah. Right, because of the pangdang. So we have to inform them, if mother tak makan veggie, we takut sembelit. Right, so have to eat meat, have to eat veggie, have to eat fruits, have to drink the soups. Make sure dia tidur bagus. When mother see me talk about breastfeeding, I will ask her, you need to rest in between breastfeed. 3 hourly pumping. So that 3 hours, you have 2.5 hours to rest. Please rest. Jangan main handphone and do this and do that. Try to rest as much as possible to get the milk supply. And when mother have enough rest and sleep, then you will see that actually emotional is more stable. Then when we come to emotional support, when you see a mother is so moody, this one have to ask Kylie lah. Some mother, there are 1 or 2 particular mothers. Whatever DIY talk, you suruh dia keluar pun dia tak mau keluar. Do we need to take some action? Usually, what will you do? What will you do? If the mother really reject, this one I don't want, that one I don't want. Okay saja lah. Yeah. There are 2 reasons. One is this mother doesn't want anyone to know her. Kan? It's memang the personality, maybe it's the social life. She want to be isolated. This one we accept. But the second one is it could be emotional. So when we don't know whether this mother is memang dia mau isolate dia sendiri or because of emotional, our thing is after you text mother about the DIY class, maybe there's already 2 weeks, mother pun tak pernah join even one. So you can actually visit the mother. Then you always visit, right? So from the visit, you don't need to ask her directly, Mommy, why you don't want to join our DIY class? Very good one. You see, Madam C also come to give you a talk. Very good. Mother just, kan? Tak mau. Right? So visit them is just to give some concern on her. What happened to this mother? You need to go in and understand her better. And if you found out that dia memang because of want to isolate, then okay lah. Because the husband is also around. But when you enter, every day you all visit mother, right? If you enter 10 times, but out of 10, 5, 6 times dia memang menangis kah, this and that kah, right? Even mother is not telling you the problems. You have to suspect she is having depression. Also, 2 types of mother. Tak mau join activity, jarang ada. But kalau ada, you have to find out which one. Kalau it's because of want to isolate themselves, that's okay lah. But if it is a second one, you will be the first person to find out the depression. Right? So, next, of course, we talk to manager or talk to the husband already. Ya, banyak kerja nak buat no. It's not the so tak mau lah. But sometimes if you are interested into this job, actually we are all women, right? Yeah, semua women So we actually understand women better. Just that sometimes we scared. I better don't kacau lah. So it's no complaint, bagus sudah kan. Sebab put your hearts into mothers and give more observations and you will notice more on what mother actually wants. Alright. Okay. Now, not only the uterus, breast, sometimes the wound pain. Now we come to the wound pain. Now, lepas beranak, perineum is the private part area. Lepas beranak, usually perineum will cause a tear because doctor will cut, right? Cut at the perineum parts, right? We call it episiotomy. Then, mother, kalau normal delivery, usually mother will have this bruising from the vagina. And usually mother will ask you a question. Nurse saya rasa macam ada hemorrhoid oh. Pernah? Tapi sebenarnya bukan hemorrhoid. It's because of bengkak. Yeah. So you have to tell mothers if it's less than yesterday, sebab yesterday beranak. Hari ini come to your center. If the pain is less, then it's normal. If the pain is getting worse, again, the bengkak could be internal bleeding also or some other issues. Jadi kalau the bengkak is getting less, that is normal. If you are not sure, I think you have the head nurse, right? Ask the head nurse to do do a perineum examination to see whether the wound is okay or it's not okay because it's really awkward feeling, right? Rasa macam betul-betul ada hemorrhoid. But actually it's not hemorrhoid, it's only bengkak, right? So what we have to help mother, sama, pad change every 4 hours and clean with water after passing urine or stool. Can take painkiller. Usually lepas beranak, kalau doktor ada kasih painkiller to mother, it is always can breastfeed. Mother's concern usually lah. Dia tanya kamu, ini ubat boleh makan kah? Then you ask her one question. Ini ubat dari mana? You beli sendiri or doktor dari hospital kasih? Or you can see the packing It's memang from Borneo Medical Center or from KPJ, you know it's postnatal and you see the tarik. But if you see only one strip, dia cuma kasih you like that. Ini boleh makan kah? Then you have to ask her, ini ubat dari mana? Or beli sendiri, then better consult doctor. Even you don't know what medication is that, right? So if it's from doctor, no problems. But if it's buy sendiri or from friends or from a relative, then better have to ask doctor, Okay. Jangan Google search sendiri Is this Voltaren suitable for breastfeeding or not? Don't Google search because Google's information is not 100% correct one, right? Especially medications, Okay. So far, okay? Good. What about cesarean section? Selalunya cesarean section apa masalahnya? Susah nak bangun kan? Mau pusing pun susah. And for some mother, they can do it themselves. Some mother, they got husband besides her. But some mother really sakit, until they need your help. Do you know how to angkat mommy up from the bed? Yes, means you pernah angkat mommy Kesiannya. Today, I give you a good news. No need to angkat mommy. Yeah, in labor ward, postnatal ward, I never angkat mommy unless this mother really low blood pressure this and that got some special condition. If this is a normal mother, just go for cesarean section, blood pressure, vital signs semua normal, saya suruh dia bangun sendiri. Now you need to teach mother bangun sendiri, bukan suruh you tak mau tanggung jawab help mother. It's not caring, no. But when you help her, she will always call you. Missy, come in. I want to get out. I want to go to the toilet. Please come in. Then you'll be very busy. You nak jaga baby. You nak jaga mommy lagi. For first day, if let's say this mother really, because of low blood, sometimes they will tell you the history, right? Because of staying in ICU for 1 week, then baru masuk KR, then of course that one we have to give more care. But for a normal mother, just delivered yesterday and today check out from hospital, coming to your side, cesarean section memang sakit. Tapi mother definitely can sit up themselves. Now, I'll show this video to you so that you pandai teach mother how to sit up by themselves. How many of you scissor before? Sakit tak? Sakit. Macam mana you bangun dari katil? So people help you, right? You tak tahu sebenarnya sendiri boleh bangun kan? Now you have to teach mother so that mother will do some movement. Is good for mother. The circulation. Actually lepas cesarean section, kenapa mereka nak suntik itu is to make sure there is no blood clot. But previously tak ada jarum ini. Previously only for those mother who is really 100 kg one. Yeah, but now they found out if can every mother receive the injection is to avoid blood clot. Kenapa pandai ada blood clot? Because mother tidak gerak. Just baring saja. Mau bangun pun suruh orang bangunkan dia. Yeah, so if mother do herself and she can do it, it actually help for the fast healing. Right? So, how to help mother? Jangan you tengok sajalah mother. Madam Sim cakap you boleh bangun sendiri bangun sendiri Ini bagus untuk kamu Oh no, you have to teach. Say, mommy, you can. You can do it yourself. Come, I guide you. Pakai mulut saja. Alright? Okay, how to bangun? Offline meh? Tak ada leh. Hotspot still running on. Okay. Sekejap I open this one. Okay. Betul-betul tak ada line. Connected? 奇怪，怎么有了。OK， 可以了。So today you learn this, then you can get mother better. Tak ada bunyi Alright, tak ada bunyi tak apa. We just see how to get up. Mother can do herself and without any strong pain. So firstly, kaki bengkok. Lepas kaki bengkok, you will see the hand try to help shift the batok to tepi sikit so that you have more place to pusing sendiri. Lepas pusing, you will see the hand, you will see the leg, turunkan kaki dulu. Then, pakai tangan support, bangun sendiri. Nanti balik, you cuba. Right? You can imagine you are having cesarean sections. So now you want to avoid using the tummy muscle. Then you do this You try whether can get up easily or not, ah. Salah pula. We watch again, ah. Yes. Okay, watch again, ah. How to transition to standing from bed. Okay. Bengkok kaki dulu, ah. So, bengkok kaki, surely it will protect the muscle. Then, shift the buttock to tepi dulu. Jangan terus pusing. Shift buttock, then pusing ke tepi. Right? Kalau bangun sekarang memang sakit. But you have to put the leg down to the bedside. Then use the hand angkat from tepi or push at the side. If there is a holder, you can push aside pun boleh. Senang kan? Yeah, no practical lah. Tapi saya mau you bawa as a homework. Balik, you try it. Right? Nanti kalau besok saya datang, saya jumpa kamu, saya tanya. Alright. Okay, a little bit more before we go for a break, huh? Now, what about kencing? Mami banyak kencing kan lepas beranak? Selalunya. Kurang? Banyak. You imagine when during pregnant, Mami bengkak the whole body, right? Tangan pun pandai bengkak, right? These are all the water. So lepas beranak, because of the hormones semua, everything go down. Dia tak perlu air banyak, sudah tidak takung air, sudah so all the air out from the body. So you will see mother frequently needs help to go toilet. Jadi kalau mami every hours nak pergi toilet, you every hour pergi angkat dia. Or ajar dia macam mana angkat sendiri. Yes, or you teach your husband how to assist mother, right? Okay, usually it will increase the urine production, to help the remove excessive fluids masa dia pregnant, right? And the bladder also decrease on the sensitivity. There are some mother lepas beranak is like urine incontinence. Means that tiba-tiba dia kencing atas katil. Right? Uncontrolled. Dia pandai macam baby pula. Dia tak dapat control dia punya urine. And then pandai pee on the bed. Right? So, jangan malukan mami. Ayuh, sudah berapa? Sudah jadi mami masih mau kencing atas katil that is not. It's because the urine, the muscle, the pelvic floor muscle is weak. Sebab yesterday dia kuat kerja. So, jadi hari ini semua the muscle lembek already. Tak mau kerja. Jadi ada urine pun dia tidak, she can't feel it. So there are two ways. One is incontinence. Maksudnya dia kencing pun dia tidak tahu. Another is more difficult. One is langsung itu kencing tak mau keluar. And they need to go hospital to put on the tube first. Tube in and tube out. Then try again. Yeah, these are all because of the muscle. So how should we help mother on this issue? Right? Yes, tell mother it's okay. Pergi kencing saja. Habis itu kencing, habis all the water retention, then you slim back. Yeah, they pun happy. Because they risau. Kenapa I keep go kencing? Something wrong with my muscle kah? Right? So for the muscle part, if mother said, ayo, saya rasa saya tak boleh tahan. Saya batuk, saya haciu pun itu kencing keluar sudah. So that means the pelvic floor muscle is not firm, is not strong enough. So we teach them to do Kegel exercise. How many of you know what is Kegel exercise? Yeah, most of you tak tahu nanti saya ajar. Yeah. Yes, you have to learn because we are all women, right? Yeah, and some more for those who ada beranak sudah lagi have to do to prevent a lot of things like uterus. Yeah, without uterus prolapse. Itu rahim jatuh keluar. One day when you grow old or 70 years old, right? Okay. So, that is what we call pelvic floor muscle weaken. Dekat pelvic sini, you tengok sini ada tulang, right? Ya, all this tulang dia ada satu muscle, satu layer muscle to support your rahim, your bladder. So all this muscle, masa beranak, it can become very stretchy, then it will be like weak. That's why mother pandai tidak dapat kencing ataupun tak dapat tahan kencing, right? So some mother will have backache. Selalu mami backache dia complain because of their Caesar, kena injection, right? Kena spinal ke, kena epidural. But in the real fact, it's not to blame on the epidural. It's actually to blame on the posture or the hormone changes, right? Semasa pregnant, you tengok all the system become very slow. Digestion slow. Selalu mau muntah, right? Because of the intestine. That is because of the muscle. The activeness low. Gusi pun pandai berdarah because the gusi jadi sangat lembut, lembek, right? Apa lagi? Sembelit, tak mau berak because of the usus again, jalan lambat. All this is because of progesterone tinggi. Try to protect your baby so that to slow down the muscle activity. And this also will cause backache because kalau you tidak betul posture, terus sakit. And usually mother pregnant, they tend to, how they work, macam mana mereka jalan? Kan? And you will see that is the posture. So when they posture like that, definitely will cause backache. And they're supposed to support the perut and masa jalan lurus. But a lot of mother, including me myself last time, tends to work like that because it's more comfortable. Tapi it really hurt the back. So you have to teach mother kenapa backache. It could be due to the hormone changes. It's not only cesarean mother will encounter that. Normal delivery mother also will encounter that. And it's very discomfort. So when this thing happens, our management to mother is to teach them pelvic floor muscle exercise. Nanti saya ajar kamu semua. Okay, and a good posture, self-care, and also rest, right? Good posture and also some exercise. I think here also got some yoga class or this physio class, right? Encourage mother to attend. Tak kisah dia Caesar ke ataupun normal delivery, they need some exercise. They need to do some stretching, okay? Teach them good posture. Kalau mau duduk, jangan duduk sengit. Jangan selalu angkatkan kaki, okay? Makan jangan makan macam ini atau main handphone like that, right? A good posture with a pillow support, that is important already, huh? Okay. Alright. So, when it comes to emotional, we will talk more for the next module too about this issue, huh? Okay. Again, kenapa mami emotional changes? Kenapa? Because of hormone changes, right? Masih ingat PMS? Yeah, your premenstrual syndrome. Ingat, you got this mood swing, right? So you remember that and link it to a postnatal mother, right? So mother might have all these emotional changes because of hormone. Yeah. So they need emotional support from family and also from you. Ya. Jangan tengok itu mami sangat fussy satu orang pun tak berani masuk bilik dia. Actually, those mother who is more fussy, lagi you have to attend her. Yeah, because it can be due to emotional. It may not because of the own personality. Yeah, sometimes they need someone to hear. Telinga buka besar-besar, and then you will see they are getting better, right? Kalau mami sangat very emotional, and then mau marah baby, should we bring baby to mother? Or should we avoid bringing baby to mother? If this mother keep crying, should you bring baby selalu masuk bilik dia as a routine, or should you avoid bring baby to this mother? Bring baby? You tidak takut dia buang baby ke dalam tingkap ke? Yeah, but you can see the answer here already, right? To bond with baby. Kenapa nak bond with baby? Tapi saya takut pula nanti dia buang baby keluar dari tingkap. Yeah. What happened when they see their own baby? Yes, it will reduce stress walaupun baby nangis. Okay, why? This is naturally when mother seeing baby cute kan, and it will stimulate the oxytocin hormone. Oxytocin hormone is a love hormone. We call it, it will relax the body. It will cause mother to produce more breast milk. It can calm the mother. Right? Jadi untuk mami yang more sensitive, more emotional, you takut baby masuk bilik nanti dia buang keluar dari tingkap, then you don't go away. You bring baby into the mother, accompany mother, maybe just 10 minutes or 30 minutes, then bring baby away. Or when family member is inside the room, then only you send baby in. Tapi jangan because of mother keep crying, emotional unstable, then we avoid sending baby to mother. Usually tidak lah, nurse tidak, tapi family member will ask. So we have to explain to family member, right? Don't worry. If mommy want to see baby, we will send baby in and we will be inside to reassure the family member. Kalau tidak, then they'll tell you, ayo, my anak perempuan already depression doctor said depression you better don't send baby masuk ke dalam bilik or can we bring baby away back home first Don't allow. You all have to talk to the mother. Don't allow family member bring away the baby because it can worsening the mother's emotion. Because bukan mami tak mau baby is family member terlalu takut risau, mother might hurts the baby. Will mother hurts kalau dia betul-betul depressed? Yes. That's why you heard a lot of like Singapore, in a very stressed country. How many times already we heard mommy and baby? Choo! This year also got one. If you read news, right? So it can be very stressed. So when we know this mother got emotional problems, yes, we have to monitor. When you send baby in, make sure there are some other relative inside. Or you have to accompany mothers. Okay. Family support is very important. So we have to talk to them. If we don't know how to talk, we can always ask them to seek for medical help. Sekarang banyak sudah psychology doctor, have to see doctor, right? Okay. Banyak kita cakap sudah. Now you have to do some class activity. Alright, something simple before we go for a short break. Take one paper, everyone, and you write down the mother's problems that we have shared ataupun yang kamu tahu tapi kita tak ada share, then you come to template here. Pass it here. If you think breast engorgement, then you put here. If you think wound pain, then you put here. Alright? So you write, everyone write a problems. Try, you can try to discuss. You ma? Right. Yes. Just take 1 minute to write. Don't take too long. Nanti saya tak habis ajar. Yeah. Yes, just one. Even the problems that I didn't teach you, you pun boleh tulis. Macam headache kah, ketiak hitam kah. Now you can write, right? So as long as you know the problems, just use 1 minute to think. That just now saya cakap sakit pinggang kah, ya sakit kepala, or this one mental problems semua tulis. Then come and template. I give you 1 minute only to think. Just write one condition. Cepat-cepat, you don't need to think so fast. Just one problem, one issue that we share just now. Lepas habis, come and template first. Come. Okay. Okay, representative. Good. You help them pass on. Okay. Anything else? Alright. Any mother worry ketiak hitam? Ada. Alright. Okay. Lagi? No more? Yeah. So you will see what is this. What is melasma? Oh, other pigmentation. Okay, you see got pigmentations. Yes, all the pigmentation also worried the mothers. Breast engorged. Mother don't want to pump or latch. Breast engorged. Milk not enough. Yeah, breast engorged. Back pain, contractions, wound side pain, right? Wound pain. Okay, perineum pain, perut sakit, right? So now, actually there are more, right? Just that repeated. You see, there's a lot of problems for mother lepas beranak. You got these hormonal changes, emotional changes, breast changes, posture, backache, uterus cramp, bladder lah, periods pelvic floor muscle weaken lah, kencing lah. Now, the first 2 weeks, these are most of the mother will encounter. Now, you put all these problems into you now. Imagine, now you have susu sakit, sakit kepala, risau baby jaundice. Put the muscle pain on you now, backache, depan sakit, period. You have to change every 4 hours. Kencing selalu full bladder, right? And apa lagi, right? So this is what happened to you now. You are now day 4 postnatal. Okay, and one day Kylie come in, Mommy, come join us for DIY class. Sangat baik mana. Come Anna, come. You mau pergi ke tidak? You tak mau pergi. Kenapa? Yes, a lot of pain. Now, another case. A mother come in. A nurse come in. Mommy, now you kasih tahu dia. They told you, you are the mothers. So the nurse told you, Mommy, itu baby dia tak mau feeding Dia tak mau kita. Selalu nangis. Boleh you come in then you carry the baby, right? Or a nurse ask you to do some things. Mami, you punya buku di mana? Kami nak buat record. Right? But you are having all these problems. Will you feel irritating? Will you feel irritating? Rasa kacau saja ini Messi. Right? Or while you are having all this pain, you go to the nursery, you mau cari anak kamu. Tapi anak kamu tengah nangis. Even the nurse know what to do. The nurse tahu. Because the baby sudah mau menenen. Got one nurse already prepared. But when you are having all this pain and you see your baby is crying, what is your first action? Geram betul. I spent 10K here. This is how you all take care of my baby. Betul tak? So sometimes we just want to put ourselves into mother's shoes. Sometimes when they see things very tiny and they complain. So when they complain, what we want to do is